Hi guys, good morning. This is Dr. Behnam, and we're about to go live. Hi guys, good morning. This is Dr. Behnam. Welcome to another AMA session. I'm Dr. Ben Behnam. I'm one of the co-founders of Happy as well as the Chief Medical Officer. Welcome. So we usually start with an introduction and we talk about like one specific topic every week. Today's topic is actually going to be about. Here, I'm going to share this. Is actually going to be about me, basically the founders, actually the two founders of Happy Ed. So we're going to give you a brief introduction about us. So I'm Dr. Ben Behnam, and my brother, actually twin brother, Dr. Sean Behnam, where we both have a dermatology and hair restoration clinic in Los Angeles, California. And we started the Happy Ed product in our clinic about 5 years ago. And we were testing it out with our patients, and we had great, amazing success. We kept changing the formula until we got the correct formula for our patients. And in about 2020, we took it live on our website, Happy Head. And we were originally in California, and then we were surprised by the amount of demand that there was, and then we slowly started expanding it throughout the entire country. And by about December of 2020, we were in every state, and we had multiple doctors working on the platform, and we had thousands of patients on the system. And after that, we've just slowly been growing and basically been expanding our product lines and making the product better. So we are really here basically to take care of you guys. We put a lot of effort and time into the products. You have to realize that all the Happy products are clinically based formulas, so they're based on clinical research and clinical studies, and their prescription as well. So it's the medical grade, high quality, premium ingredients. And we were actually the first topical finasteride product in the US market. And we're still the only customizable one in the US market to right now. So again, we're both hair doctors, and Sean only does hair transplants. I do a lot of other stuff, hair stuff like PRP and stem cells. And we use the Happy products daily in our office every day as well. Uh, so um, so that was a little about us. So I'm gonna start basically by answering the questions, and if there's anything, if you guys have any comments or anything, please let us know. We're also on our Instagram page as well. So I'm 86 years old, and basically I have large white calcification on my forehead and arms. Calcium, I assume. So I have a patient that's who's 86, and they're saying they have white calcification on the forehead and arms. Well, I don't think that's from the Happy Head. I'm a little confused. So I've never had anyone basically saying they had calcification or droplets basically on their forehead and arms from using the product. So if you don't mind, please reach back to us and with a little more clarification on that question, and also send us photos. I know sometimes the product could cause some irritation. So that is understandable, but I've never seen any calcification. So please let us know. Hello, I was told I have scarring alopecia and that certain areas where I'm thinning may never grow. I'm currently taking injections around the edges, which is the main area I'm battling, but there is anything else I could recommend in addition to the shot? So that's a very good question. So scarring alopecia is actually very difficult to treat. It's also known as cicatricial alopecia. Typically, the main treatment for it is injection of cortisone, steroids, and that by itself may or may not help as well. I do have patients in my own personal clinic that have scarring alopecia and do use Happy Ed, but I honestly do not think it really works. But I don't think it's gonna hurt you either. At best, it could help prevent the other hairs basically from falling out. I do recommend probably using it along with a Derma Roller. Basically, that could help as well penetrate the product in. But I think the injection is the mainstay of therapy in dermatology, as far as we know right now. Been using Happy for 6 months. Worked great for my hair, which is great. Thank you so much. Glad to hear that. But no difference in the crown area. should I try the dutasteride formula? Yes. So look, it's possible that it could work in some areas better than others. So it could work better basically in the front and basically compared to the crown. It really depends on how much hair you already have there. So if you're already balding the area, happy head on honestly anything else, I mean the orals is not gonna work. But if you have basically kind of peach fuzz here in that area, then basically the topical, I mean the oral medication could cause the hair to grow out. You could definitely switch over to the dutasteride formula. It is supposed to be better. Dutasteride inhibits two enzymes, whereas finasteride inhibits one enzyme. So dutasteride is a better formula. And to switch that out, just email support staff help at Happy Head, and we'll be more than happy to switch it out for you. Thank you so much for that question. A question from our Instagram. I'm a 28-year-old female who has been taking 1 milligram of finasteride. Could I get a happier person with finasteride? I'm extremely aggressive, and she also takes 100 milligrams of spironolactone. So basically, everyone has a different comfort level with finasteride. At Happy Head, we typically do not prescribe finasteride for females below age 50, whereas some other doctors might. So finasteride is a category X, and we just do not prescribe it to females below age 50 at Happy Head. Again, if you're above age 50, female, we were more than happy to give you basically finasteride. I see the patient is already on spironolactone 100. I think that is already very good. You could also add minoxidil basically to the regimen, but you have to do it at a very low dose. But she's also taking the 1 milligram finasteride. So I think if you're taking 1 milligram finasteride and spironolactone, those two basically should already be good enough. But unfortunately, we do not prescribe topical finasteride to female patients. Thank you so much for that question. How much happier topical is absorbed systemically by the scalp, and how likely could you get side effects from the hydrocortisone like cataracts and glaucoma? So that's a very good question. So typically, the amount of topical happy that's absorbed it's proportional and related to how much you're using. So if you look at the clinical studies, using a 1 ml twice a day, which is recommended, it gives you similar equivalent pharmacokinetic results compared to oral finasteride, which means is that if oral finasteride reduce your serum DHT by 50%, using topical Happy Head twice a day will give you similar reductions in serum DHT level. However, the side effects we know are less compared to oral, which means that basically the serum DHT is not the only way basically that gives people the sexual side effects. So now with respect to the cataract, that's a very good question. So if you actually ask ophthalmologists, they'll tell you that using the higher strength of cortisone basically around the eyes is okay. But here's the thing: you're not using the Happy Head around your eyes. You're basically using it basically on your scalp, and it's not around the eyes. So the risk of cataracts and glaucoma, according to clinical studies, actually I don't think ever any cataracts glaucoma reported in any of the clinical studies using the topical finasteride. And majority of the topical finasteride out in the market actually use a much higher strength of cortisone. We are the only one that uses the lowest amount of cortisone in our product. We use an over-the-counter cortisone. So it's a very, very low amount. So the answer is that basically, look, there's always risk, but basically they're very minimal. Can use Happy Head on color treated hair? Yes, you could use Happy Head, and it should not interfere with the color. Any ingredients will interfere with color treated hair? No, there's really no ingredients that interferes with it. It should not really bleach out the color or take the color out. Thank you for that question. Can I get Happy Head every 2 months instead of once a month? Yes, you could. Please email support, and they'll be more than happy to put you on a every 60-day subscription as opposed to every 30-day or 27-day subscription. How long did it take you to develop your formula? That's a great question. So we introduced the formula back in 2016, but the original formula was actually very different. It had a much higher dose of steroid in it, much lower dose of finasteride in it, and it had azelaic acid, which is very irritating, and did not have retinoic acid. So we really changed the formula quite a bit. It pretty much took us 2 years to really success to get a really good formula that was not very irritating, but at the same time tolerable and basically something that's going to work. And we really did that mainly in our clinic. And we just kind of constantly try to revise the formula and make it better. And even to this date, we still are trying to work out with the formula to make it better. We're currently working on a formula that doesn't have aloe in it. We're currently also working on a formula that does not have water base. That's a water base, which means it has less propylene alcohol and ethanol alcohol. So we're always doing research to make the formula better. This past year, we have come up with a topical spironolactone formula and also topical dutasteride formula. So, we never stop, guys. We're always working to make our Happy Head product better and better. And unlike any other product out there, we're customizable, which means that if there's an ingredient that you do not like in there, or it's irritating, or it's bothering you in some way or another, or if you're allergic to any ingredients, we'll be more than happy to take that ingredient out, revise the formula, customize it for you, and basically ship it out. So we're the only customizable topical finasteride formula in the U.S. market. Why is twice a day recommended? Even oral finasteride keeps the enzyme blocked for a few days, so it's not about the half-life. And topicals typically have a longer half-life in the tissue as opposed to oral. So the reason why twice a day is recommended is because that's how many of the clinical studies have been done. And if you look at the pharmacokinetic studies, you see that in order to achieve similar pharmacokinetic levels compared to oral, basically you have to use it twice a day. Now, that doesn't mean that everyone has to use it twice a day. I actually had a call with a patient this morning that he said he was getting great results by using it once a day. So if you feel comfortable using it once a day, that's perfectly fine as well. But typically, patients that do it twice a day see better results. I've been using Happy Head for about 2 months, and here are two things. If I leave it on my head, especially overnight, it hardens, then it's hard to scrape it off. And now that the scalp area is sensitive, so how long should I keep the solution on my head? So here's the thing. So you don't really have to sleep with the product on or keep the product for 12 hours a day. There's some patients that actually wash the product after an hour or two, and they still see very good results. So if the product is making your scalp sensitive or is hardening on your scalp, just wash it off after an hour or two, and you'll do basically just fine. Thank you so much for that question. I'm taking oral minoxidil and finasteride. Is it okay to use the Happy Head formula in conjunction with these medications? Yes, it is. As long as you've been on the oral finasteride and oral minoxidil for a while and your body has gotten used to it, you are allowed basically to start doing the topical Happy Head as well. My recommendation would be not to do it twice a day right away, but kind of slow ease into it. So maybe do it once a day for the first 1 or 2 weeks, and then basically do it twice a day. Now you should be seeing actually really good results. If you're on oral finasteride, oral minoxidil, and topical finasteride with minoxidil, I think you should receive very good results. So good luck with that. And obviously, if you have any side effects, please let us know. If one of our patients asked a question through our Instagram, how is Happy Head different than Keeps? So Keeps is an oral finasteride medication. So basically, you're already taking the medication orally. Now, oral finasteride has a risk of sexual side effects. About 2 to 4% of patients may experience sexual side effects. One of the reasons why we came up with the topical Happy Head is because topical Happy Head is topical finasteride with minoxidil, and there are many clinical studies showing that the topical product works as well as the oral, but has a lower risk of sexual side effects. So that's how we're different from Keeps. So we're topical finasteride medication, whereas Keeps basically is an oral medication. Their topical is just topical Rogaine over the counter, but our minoxidil Rogaine is prescription strength. So it's prescription strength minoxidil with topical prescription-grade finasteride with retinoic acid. So we have 3 products all in one, whereas Keeps is just one oral medication with an over-the-counter minoxidil. And it also their products basically is mass produced, is made for everyone, whereas ours is customizable, which means that, let's say you come back and say, Doc, I don't want the hydrocortisone in my product. No problem. We'll take the hydrocortisone out, we'll make a new one, and basically we ship it out to you. You come out and say, Doc, you know what, the minoxidil concentration is too much, can you reduce it? Absolutely. We'll customize it for you. Our product is made fresh on a monthly basis just for you. So we make it fresh, we customize it for you and ship it out. Whereas other companies is made and is sitting on the shelf for a long period of time and it's one size fit all with them. Ours, we really customize it just for you. So we're here to help you out in any way possible. Thanks so much for that question. Also, another patient, another person on Instagram said, where do you formulate the medication? Is it manufactured in a central lab? So basically, all of our Happy products are made in New Jersey, basically a facility, pharmacy, New Jersey. So everything is made basically in the US and is literally customized and made fresh every month basically for you guys. So nothing's really sitting on a shelf for months and months and months. It's made fresh and basically shipped out. This is why we're able to customize the product because it's made fresh for you guys every month. And if there's any issues, you let us know and we'll be more than happy basically to address the questions. And does minoxidil cause hair growth underneath the eyes? Typically not. Minoxidil could sometimes cause some irritation or darkness underneath the eyes. So if that were to happen, please let us know right away. And what we could do, we could reduce the minoxidil concentration and ship you out another bottle. Second question, should I be using a 0.5 millimeter Derma Roller instead of 0.25 to get better results? So here's the thing. So we typically recommend the 0.25 because it's easy to get. It doesn't hurt that much. Now, on the internet, some patients do say that they're using the 1.5. I think the 1.5 really hurts. I use the 1.5 in my clinic on my patients, basically that are numb and it still hurts them. So I recommend the 0.25. Now, if you could tolerate the 0.5, that's fine with me. But we're typically recommending the Derma Roller, the 0.25 millimeter depth. After shower, does the scalp need to be completely dry before applying? No, you could apply Happy on wet hair or dry hair. It doesn't really matter. You could do it once a day, twice a day. It doesn't really matter, but twice a day is the best way of doing it. Best success story. I saw a patient yesterday, African American. I saw him in August, and I saw him back yesterday, and he was using the Happy. And honestly, he wasn't really sure if he was seeing results or not. So I took a photo of his scalp, and he was seeing amazing results. In fact, his scalp, you could not even notice it compared to the before photos. So he was extremely happy. Now, success story. Everyone's success story is different. Sometimes patients are not losing a lot of hair, so they want to maintain the hair that they have. So they use Happy to maintain that hair. So for them, that's a success story. Some other patients are really thinning. So basically by using Happy and getting 20, 30% more regrowth, for them, that's great. So everyone's different. And so what I recommend is that you don't know how you're going to respond to the product. And it takes about 4 to 6 months for you to see the best results. So my recommendation is to use the product initially once a day. Then after a couple of weeks, start using it twice a day. If you use it along with a Derma Roller, you're going to see the best result. And remember, it's an overall approach. So if you use the Happy along with taking multivitamins like vitamin D every day, females taking an iron tablet every day, and you add collagen and protein to your diet, you're going to see the best results. But if you have any other success stories, we love to hear the best success stories from our own patients. So please email it to us and we'll talk about it. Why did you choose the name Happy? That's a very good question. I'll tell you, it actually almost took us about 8 months to come up with the name. We had called them many different things. And me and my wife were the ones that were brainstorming, and Dr. Sean basically to come up with the best name. We had initially actually called it Huddy Hair, and that didn't go very well. We didn't like it, and what happened was I was passing by the the Happy Socks in Century City Mall in Westfield, and I'm like, wow, Happy. I like that name, Happy something, and I think there was another company called Bedhead or something. And that night, I told my wife, I'm like, I really like the name Happy Hair. But the problem with Happy Hair was that there was a lot of too much competition on the internet with Happy Hair. And the next morning, I'm like, I got the name. It's Happy Head, and it really stuck, and a lot of my patients liked it. And actually, our website domain was initially called Hi Happy Head, but we were finally able to secure the name Happy Head. But that's how we came up with the name Happy Head, and a lot of people liked it, and so we just went along with it. So that's really how it came along. But it took a while, a lot of brainstorming to come up with that name. Thank you so much. Actually, I love this. Everyone's asking how we came up with the idea, with the company, and with the product. It was not overnight. Honestly, Happy it took many years, before it became a brand. So it's been really ever since 2016. It's been many years in the works. So, but now we have a whole team, a CEO, CFO, and we're in every state, and we have thousands and thousands of patients on the product. So it really makes us, the co-founders, really happy that it's really taken off. If I take oral finasteride and use topical minoxidil with Happy Head, would Happy Head give me better results? Yes. Yes, if you do the oral finasteride along with Happy Head, you will get better results. But I do not recommend you starting them simultaneously. I usually like patients to start the topical Happy Head first, so your body gets used to the finasteride, and then you can go on the oral finasteride. Now, if you're already taking oral finasteride already, then you could easily incorporate Happy Head, and you should be fine. Again, always watch out for side effects. But typically, if you've been on one of the products with no side effects, you should do fine. Oh yeah, somebody did ask, what did you call your Instagram Hi Happy Head? So the name of the website initially was Hi Happy Head, and only a year into it was that we're able to purchase the domain happyhead.com. But the product was always called Happy Head. Can topical finasteride cause facial bloating and increase facial wrinkles and bags underneath the eyes? Yes, it can. Even the over-the-counter minoxidil could cause that as well. It is not very common, but it could cause bags and swelling underneath the eyes. We really do not know the mechanism for it, but if that were to happen, please let us know, and we'll be more than happy to customize the product, take away the minoxidil, and ship you out another one right away. Again, we have thousands and thousands of patients on it, and maybe only one or two had actually that side effect. So it's pretty rare. Anyone went from oral finasteride and topical minoxidil to topical Finmin and got improvement. So I have a lot of patients in the clinic that did do that and pretty much saw similar results to taking the oral finasteride. One of the main reasons that people switch over from oral finasteride is because they don't want to take the pill orally because of the potentially like other side effects. And in clinical studies, the oral and topical finasteride has been shown to have similar results. Now, I'll tell you, some patients actually on the topical Happy Head, I've seen this, have better results compared to oral. Reason being because when you take oral, 95% of the drug goes everywhere else and only 5% goes to the top. When you do topical Happy Head, 80%, 85% stays right there. So you're getting more of the product where you really need it. So you have to realize that everyone's different and patients can have different results and the results varies. But generally, oral finasteride and topical finasteride have similar efficacy. If you use the topical Happy Head along with the Derma Roller, you might even have better results. And if you use the topical Happy Head along with the oral finasteride, you can even have more superior improvement. Thank you for that question. If I'm thinking of having a child, how early should I stop before trying? Any concerns of having a deformed child? So finasteride is a category X medication, which means if a female is pregnant, FDA states that you should not be using, you should not come in contact with topical finasteride. So we typically recommend that before you guys start trying, about 2-3 months before, stop using topical finasteride so you do not expose your partner who may become pregnant to finasteride. So really, that's the thing. So a pregnant female should not come in contact with finasteride, topical finasteride. Any idea how much your formula reduces serum DHT? It really depends on how much of the product you're using. There are 2 pharmacokinetic studies done on this, and I have summarized the studies on our blog. So if you just go to happier.com, at the bottom of the page, there's a blog section. So you click on it, and basically you could go to the blog. I believe that oral finasteride reduces serum DHT by 50%. And if you use Happier twice a day, that means 1 ml twice a day, you're pretty much getting equivalent serum DHT reduction, which is roughly about 50%. I have to look up the exact numbers, but that's where it's at. Now, obviously, if you use the product less, you're going to have less serum DHT reduction. If I'm applying just to a crown, how much formula to apply? You should apply 1 ml twice a day. It's very simple, and you should see really good results. And if you use it along with a Derma Roller, 0.25 millimeter depth, you should even see better results. Are there any attributes to Happy Head other than the hair growth? Vitamins, hair thickening. So if I'm understanding your question correctly, am I understanding this question correctly?
Yeah, I think it doesn't do anything else.
So there's no vitamins in it. So it's basically mainly a hair thickening product. So it will cause basically your miniaturized hair basically to thicken up and get thicker. I mean, we are coming out with our own separate vitamin, which we should be out very soon. And we're also coming out with our own hair thickening shampoos as well. And this is all dermatologists developed by me. But Happy, the product itself, basically, is just mainly thickening, is used to thicken and regrow those miniaturized hairs. Could you give the reference over email for the clinical studies? Yes, we'll be more than happy to email those clinical studies to you. I'll have Evelyn email it to you. Thank you so much. They are on our website. They're on the blog, but she is going to email it to you. Thank you. Can you talk to water retention with spironolactone? Does the topical have the same issue? So spironolactone is a diuretic. So it's going to make you pee more, and you're going to actually have a couple pounds of water loss. Very rarely, patients on oral spironolactone could have the exact opposite thing happen, where you get water retention. That's honestly really rare. I've been prescribing spironolactone for 14 years now, and probably this has happened only 2 or 3 times. The topical, yeah, it could happen, but it's extremely rare. I mean, we've never had actually anyone on the topical spironolactone complain of water retention. So it's pretty rare. How often should I use a Derma Roller? So we recommend the Derma Roller 0.25 millimeter depth. You could also actually get a Derma Roller from us. So just send us a message, and we'll be more than happy to send you a Derma Roller. You should probably be using it every night. So we recommend applying the product on top and then gently Derma rolling it. You don't want to be too aggressive. Do not make yourself bleed. Again, we do not recommend Derma Roller that's higher depths, like there's 1.5. I think those are just way too much, and it really hurts a lot. So using a 0.25 Natalie, it's recommended. Do you recommend applying Happy and leaving overnight? Yes, I do recommend that. That's how it's usually supposed to be used. However, if it's causing you irritation or too much flakiness, then you don't have to do that. Then you could just you basically after an hour or two, you could just wash it off. That's no problem, and you should still see pretty good results. Can I buy the bottles rather than a monthly subscription? Yes, you could. Just email support. So as soon as you start, basically the subscription, email support, say, can you please get me off the subscription and go on manual plan, or like every 3rd month or whatever you want. And they'll be more than happy to help you do that. Our support address, email address is help@happyhead.com. Where does spironolactone fit into this regimen? So typically spironolactone is for females, not for males. And so there is an oral spironolactone drug, which is #1 oral medication for female hair loss. Some patients that don't want to do the oral, there's a topical version of it that's mixed with minoxidil 6% along with retinoic acid and hydrocortisone. So if you're female below age 50, you basically have 2 choices. You could either go on an oral spironolactone medication or do the topical spironolactone. And you could actually also do oral minoxidil. So when you actually do, do them initial medical consultation with our doctors probably choose the best thing for you. But if you want the oral stuff, say, look, I prefer to take oral. And if I'm topical, and say I want the topical, and a doctor will customize the medication based upon your past medical history, as well as your allergies and your age and your sex. And you could also probably be on the oral spironolactone as well as topical as well. But again, you could discuss that personally with your doctor. After applying, should I massage into the scalp? And if so, for how long? Yeah, just like for like a minute or two, just for 30 seconds. Just rub it in and basically just make sure you wash your hands afterwards. Um, I use a 2% cuticle shampoo. Can I use Happy Head product along with this? Also, would you recommend using 2% shampoo daily? So I like the 2% shampoo. We are making that available on our website. So it should become available soon. So you could also buy it from us. And yes, we certainly do recommend using the shampoo along with Happy Head. I do not recommend using the shampoo, the kind of the 2% every day. So maybe every other day should be good. That should be fine. Just because it could be a little bit too irritating. So you could use other shampoos in between those days that you don't use the ketoconazole shampoo. Any new ingredients on the horizon will be added to your formula. Why did RU never get the approval? So we are looking at other ingredients, but for right now, we are just sticking to what we have. We may be adding some caffeine to some of the Happy Head products, but as of right now, we're not there yet. Anytime we add any ingredients, honestly, it goes through months and months of rigorous testing. Just in our clinic, just to make sure things work out well and there's no adverse events. So adding new ingredients to the regimen basically sometimes is somewhat challenging. The RU, so he's referring to, there's another product called the RU. It's not an FDA approved. That's why it didn't get any FDA approval. And as of right now, we don't recommend that product. If I already have a current prescription for oral finasteride, do I still have to have a doctor's consult? Yes, you still have to get a consultation from us. We do not charge for consultations, so you're just basically literally just paying for the product, but we do not charge our customers for consultation at all. We actually pay our doctors separately. So yeah, so it's not going to cost you a dime to have that doctor consultation. Legally, you do have to fill out that form online and submit photos and submit a driver license. So it's as if going to a doctor's office. So all those you have to do legally. Do you know if Happy discolors hair color? No, it does not discolor any hair color. So you're safe to use it. Do laser caps work? Look, in some patients, I think they do. I know there's some laser combs where there are only 12 light bulbs and LED lights. And those, I don't think they work, but I think the larger caps where they have 30, 40, 50 LEDs or more, I think they do work. And look, some patients use them and they tell me that, look, they get improvements. I think it's about more like 50, 60%. So I think everyone's different. And honestly, you're not going to know if it's going to work for you or not until you try it out. Obviously, the topical Happy is different because these are prescription grade products that you need a prescription for, made by a prescription grade pharmacy and shipped out to you. So in my opinion, I think the prescription grade products work better. If you want to use them in conjunction with the laser caps, that's fine as well. If I visit LA in August, can I stop by your office to have an in-person consultation? Yes, please do. We love to see you in person. We actually have a lot of people that travel and see us in person. We have people from Australia, London, India, and just throughout the US that come by. Yes, please, you could email my own personal clinic, which is support@santamonicaskin.com, and they'll be more than happy to make an appointment for you. No problem. Do you use Happien and how long? Great question. So actually, I used to be on oral finasteride years ago, and actually, I did used to use Happien. But what happened was that we got pregnant. My wife got pregnant, so and we've had a couple pregnancies one after another. So I had to stop using Happien back in 2018, and I haven't gone back on it. But as soon as As soon as we stop having kids, I plan to start using it again. My wife basically is still breastfeeding, so I'm not using Happy yet. Um, why did you decide to become a dermatologist? Great question. So basically, when I was in med school, I honestly fell in love with the skin. I've always had skin issues. Personally, I've had acne issues, and I have alopecia areata. So I have an autoimmune hair loss issue that I've had for many years, and my twin brother also has alopecia areata. So I've been seeing a dermatologist myself for my acne, eczema, and hair loss issue pretty much all my life. So dermatology was one of those things that I was very familiar with, and that's what really attracted me to it. And again, the alopecia areata is an autoimmune condition where basically you lose basically oval patches of hair loss kind of everywhere. And I treat myself basically all the time. So I have this true devotion basically to hair loss and seeing people with hair issues basically kind of try to overcome that hair issue. My style has gotten quite rough with little hair growth. Any recommendations on what to do? Uh, I do use a derma roller. Could that be the reason? So look, it really depends on basically on the amount of hair peach fuzz you have. So look, some patients are bald, and if you use Happy Aid, look, Happy Aid is not going to help you. I mean, I have patients that send us photos every day, and they're completely bald, and I tell them, look, do not use Happy Aid; it will not help you. So, and sometimes it may not work. Remember, not everyone is going to respond. So my recommendation is that first of all, please send me your photo, and I'll be more than happy to evaluate you. Just send your photos to help@happy.com, and they will forward it to me. Number two, derma roller really does not cause, unless you're using it very aggressively. Typically, it tends to be a good thing, not a bad thing. So let me take a look at your photos, and we'll go from there. Sometimes actually switching over to topical finasteride might help you more, and sometimes adding an oral medication will help you as well. Look, in my own personal clinic, I have patients on oral finasteride, oral minoxidil, and topical Happy Aid, and sometimes it just doesn't work. Some patients just it doesn't help. I mean, and we don't really haven't figured out, whose those categories of patients are, but we take it one at a time, and that's why this is a prescription medication, and you have to work for your doctor to really come up with the best customized solution for your hair loss. How effective is PRP treatments? Is treatment more of a one-time thing or regular thing? So PRP is it stands for platelet-rich plasma. We take your blood, we centrifuge it, take the growth factors, and inject into the scalp. So I've been doing PRP for almost 13 years now, and I'll tell you, when I started doing it, initially, I was not very good at it, but now I truly believe that I'm a lot better at it just because we use a very special way of doing it. We draw a lot more blood, we spin it a lot more. We do add a special additive to it to activate it. And I love to use basically my gun, which is called a mesotherapy gun. And one of these days, I'll bring it in. I'll show it to you guys. It's a really cool gun. You guys will love it. So PRP does work, but it's not a one-time thing. You have to do it multiple times. Typically, we do it basically twice initially, and every 9 months, basically, we do it after that. And it really does help quite a bit with a lot of our patients and hair growth. Again, you can always come into my clinic, and we can always talk about it. There's PRPs, there's stem cells, and again, I'm a big fan of PRP. And in conjunction with Happy Aid, I think it works very well. In our clinic, every patient that does a PRP or stem cell, actually they go home with a Happy Aid product. And I think the combination of the two does really help a lot. Do you think mechanism for senile alopecia is the same thing as male pattern baldness? Yes, pretty much they're all the same. I mean, male pattern thinning basically gets accelerated as we get unfortunately older and also go through stressors. So it's pretty much the same pattern. Look, I have patients that in the 70s and 80s and they use Happy and they still see very good results. Typically, when you're younger, you tend to have better results though. So again, everyone's different. Results varies. My recommendation is fill out the consultation form online, and a doctor will see if you're a good candidate or not. If you're not a good candidate, we're gonna say, I'm sorry, we're not a good candidate. This Happy is not for you. But if we do feel you're a good candidate, then we'll ship the product out to you. And if you have any question with respect to see if you're a good candidate or not, you can always email your photos to help@happyed, and they will run it by me. I'm the chief medical officer, and I could go through some of the photos and see if you're a good candidate or not. Another question from Instagram. Doctor, have you conducted clinical studies and conclude that the topical application is effective? Actually, we have thousands and thousands of patients on Happy, and we know it's effective and it works. But you have to realize Happy may not work for everyone, and everyone responds differently to it. And the reason for that is many reasons. It depends on your testosterone level. It depends how much hair you have, and how much pitch fuzzy you have, and where you really are in that hair thinning or hair balding journey. The earlier you start, the better results you're going to get. Now, Happy Head was actually based on multiple clinical studies that are published and available on PubMed, and also they're also available on our blog section as well, which I've summarized. So you can read those clinical studies, but Happy was based on clinical studies, and over the years we've actually modified that. And there was recently another study showing that topical finasteride works very well. It's very effective. It was literally just published a few months ago, and this is something that we knew years ago. So I believe we've actually been years ahead of what the clinical research is finally showing us. Uh, do you think we'll ever have a cure for male pattern baldness? I hope so. I know there are a lot of people that are working on it. I know cloning has been in the works for the past several years in Europe. It has not been perfected yet, but we're getting there. And look, I think we're all working on it. And I'm happy it. We're constantly working on coming out with the next best thing. So, you know, we just like everyone else, we're doing our own research as well. Okay, I'm just looking through basically other questions through Instagram. Again, so just a couple other things. Again, another person asked on Instagram, is it okay to modify the frequency to once a day as opposed to twice a day? Yes, you're more than welcome basically to do that. Again, twice a day patients typically do better compared to once a day, but please, you're in control, so you could do whatever you want. If you feel once a day is not enough, you can always go to twice a day. What a lot of patients do is they start with twice a day initially. They do that for about 4, 5, 6 months, and once they see the results they like, they go down to once a day, and that could maintain the results. But again, that may not work for everyone. Again, a couple other things we've talked about in the previous sessions: the effective use of Derma Roller. I do like Derma Roller 0.25 millimeter depth. Gently, after applying the topical Happy Head, gently roll it on your scalp, and that's going to help. Do it nightly. Do not be very aggressive, and do not make yourself bleed. Again, with Happy Head, consistency is the most important thing. Just be consistent about using it every day. That's how you're going to get the best results. Also, please remember that Happy Head is a customizable formula. We at everyone at Happy Head, we are here to help you. This is not a product that's been sitting on a shelf for many, many months. This is a product that's actually customized just for you. So if there's any issues with the product, any irritations, please let us know. We'll switch out some of the ingredients and we'll ship you out another one. We want you to be happy. We want you to have the best growth possible. Are there any deals for buying in bulk? Yes, you do get some discounts. I'm going to have Evelyn basically post the links. But yes, there are some discounts you could get. Thank you for taking your time to answer our questions. You've been very helpful. Well, thank you so much, everyone, for all those questions. And thank you so much for joining in us with another session of AMA with Dr. Ben. Again, I'm one of the co-founders of Happy Head. It really took us many years to come up with the product and also to come up with the name Happy Head and to build out the infrastructure of being available in every state. I mean, I remember, as my wife could attest to this, I would really get up at 4 a.m. every morning and start working on this before, I had to go into my clinic around 8:30. And, it took us about 6 months to become nationwide. And I always tell my wife, it was very easy. Once we became nationwide, we just had to put the word nationwide on our website. And, I told her it was very simple, just the word nationwide. It was very simple to write, but honestly, it took hours and hours and hours and hours of work and dedication to really get it, streamlined and basically to that level. So But I'm really happy. I truly believe Happy Ed, we have been able to touch a lot of people's lives, and we're basically providing a product out there that no one else provides, because it's a customizable topical finasteride solution for hair loss. And there are a lot of patients that honestly were having a lot of side effects with oral finasteride, and this is exactly why we made Happy Head, to have an alternative to oral medications. And a lot of patients, I know as a fact, there are a lot of patients who had side effects and could not use oral finasteride, and now they're using topical finasteride, and they have much thicker hair, and they have more confidence on a daily basis. So I'm very happy that we're able to touch patients' lives in that way. So, okay, everyone, thank you so much for joining me. Again, thank you so much for Evelyn, who coordinates everything, and thank you so much to Eric, our VP of operation, who's currently in New York right now, but I'm pretty sure he's listening to everything I say. Please join us next week for another AMA session with Dr. Ben. Thank you so much. Have a beautiful day. Bye, everyone.